this is a very big effort that requires many partners, and we want to commend the efforts of the Africa CDC for its leadership in coordinating the efforts in order to secure vaccines, but also to ensure that these vaccines can be allocated and deployed to the areas which need most. When the vaccines become available, there is a complex process, obviously, with regulatory approvals and other logistics, as well as contracts that need to be put in place, either through donations or the purchase of these vaccines to have them arrive in the country. Surveillance efforts to identify the progression of this disease, and I think this has really helped the Africa CDC and the WHO to identify, the emergence of the new clades and the changing, behavior of this virus. This has really helped to ensure that, a public health emergency of international concern was declared a few weeks ago in order to galvanize efforts. So I think the efforts of the countries and the Africa CDC really has been commendable in order to ensure that the international and regional and national governments can galvanize together to respond. And so I have also been very encouraged by the recent publication of the Continental Plan that the Africa CDC and WHO led, and GAVI will be supporting that plan and its implementation to ensure that we can all collectively bring an end to this current health emergency as soon as possible. So at GAVI, for example, we had our managing director for country programs, Mr. Tabani Maposa, arrive in Kinshasa. He met with the president and minister of health, the director general of the Africa CDC, and others in order to extend our support for efforts. At GAVI, we have also provided already rapid funding support to the countries like the DRC in order to support their initial efforts. So I do think that the governments have been alert to the situation. I think they have taken some rapid initial action, and we have been discussing, what more we can do beyond the initial funding that we have provided for the immediate response, as well as the procurement of vaccines that we hope will arrive very soon as well. But we stand ready to support the governments, and we do think that the governments have been thinking through this and really making plans on how to control this health emergency.